I had my babies and they ruined my teeth. And again, not true. Your children don't ruin your teeth. When you are pregnant, you can have an overreaction. So they call it pregnancy gingivitis, which is inflammation of the gums. Your mouth is a gateway to your body. And if your mouth is healthy, it affects everything else. Why do we have to floss? Something as simple as correcting your smile has that much of an impact. It's never too late to straighten your teeth. Give yourself that confident smile. Do it once and do it properly.
I'm a bit more worried about your answer for this one. How do hormones affect our teeth? This is Fernwood Unfiltered, the podcast for straight up expert-backed advice when it comes to women's health and fitness. And today, what an episode we have in store. If you have ever felt self-conscious about your smile, if you've struggled with dental care or wondered just how you can straighten your teeth safely, that's key, effectively, also key, and you're ready for expert tips to boost both your confidence and your oral health, this one is for you. Dr. Sarah Lawrence is a specialist orthodontist and clear aligner expert with more than 20 years' experience. She's treated thousands of patients of all ages with clear aligners and braces, a passionate educator and clinician. She teaches orthodontists in training how to master aligner therapy while helping her own patients gain confidence. When she's not perfecting smiles, she's cooking, gardening, traveling, or spending time with her husband, fellow specialist orthodontist and business partner, her 3 daughters, and their dog, Fluffy Moodle, with the most gorgeous name of Otto. Dr. Sarah Lawrence, welcome to Fernwood Unfiltered.
Hey, thank you. Really pleased to be here.
I am very much looking forward to our chat. This is one of those, I want to say peculiar for want of a better word, but peculiar subjects of interest to me. I have always been interested in oral health, and then working in the fields that I've worked in, I've just found just how important it is the older that I've got as well. So we are going to have such a great conversation. Before we get to that though, for everyone who is listening right now, what do you hope they take away from our chat?
I guess just be really mindful of your oral health. Make sure you're cleaning properly, looking after your teeth, going to a dentist, have regular checkups, because your mouth is sort of the gateway to your body. And if your mouth is healthy, it affects everything else.
Let's get straight into it. Why is it so important to consider oral health as such a key indicator to your overall health?
Really good question. And I guess, oral health, we are essentially our intestinal system starts with our mouth, okay? So we're like a tube that goes all the way through, and it starts with our mouth. And if our mouth is not healthy, if we've got inflammation in our mouth, we've got, bacteria in our mouth, that's going to work its way right through your whole system. So it all starts with your mouth for sure.
Is it crazy that I've actually never contemplated that? When you're talking about intestinal health or gut health or anything to do with that system, I'm not thinking about my mouth.
Yeah, that's really common that people don't. But if you think about it, where it all starts, that's where the food goes in, and it's the start of everything. And, if you're not looking after your health, you can actually really have some, health impacts as well. So things like heart disease are related to gum disease and that kind of thing. So systemic issues can be there if you're not looking after and taking care of yourself from an oral health perspective.
In considering your vast array of experience, how often would you say that you are treating a patient who is completely unaware that, that the tooth that's been annoying them or this little bit of redness on their gum or something is actually a sign of something bigger?
So again, I'm a specialist, but I do, get patients in and I see them and they may not have seen a dentist for quite some time. And we do pick up things like, gum disease, inflammation, dental decay, that kind of thing. And we'll refer them back to their general dentist. But that's why it is really important to keep up with your general dentist checks, and every 6 to 12 months just to check everything's okay. Because sometimes you're not even aware that there's a problem there. Things like gum disease don't necessarily hurt. Start of decay or mineral loss doesn't really hurt either. But if you can pick it up early, you can, really get onto it and stop that being a big problem.
Let's talk about then the difference between a dentist and an orthodontist.
Good question and dear to my heart. So, and there's a lot of confusion here about the difference. And sometimes I think the wording is quite confusing. So a dentist is someone who looks after your dental health, does your checkups, does your cleans, does fillings, if you've got holes in your teeth, that kind of thing. And an orthodontist is a specialist dentist. So we've been a dentist before or first, and then we've gone back and done 3 years of full-time training for a master's just to be experts in teeth straightening, correcting bites, that kind of thing. That's all we do. There's quite a distinction between the two.
Often over the course of my life, I mean, it's a very lovely compliment that I get, but people say I have a lovely smile. They go, oh my gosh, you've got such great teeth. And I say, thank you so much. I was not born with them. In that I, growing up, had a really, really pronounced overbite.
Right.
I've had every rubber band under the sun that you possibly could. I was that cool kid that wore headgear for a million hours a day. And in my head, though, that was all through going to see my orthodontist quite religiously for a couple of years of primary school and then beyond. So there was a lot of effort put on my behalf, but also for my orthodontist and work, right? For my teeth, I think, to still be in a very, very good shape. I got my braces on when I was like 9.
Right.
So, that was, not to age myself, a real long time ago.
Yeah.
And I just happened to have lost all my teeth by then and all of this.
Yeah.
Why is it so important that you go see an expert when it comes to clear aligners or wanting to straighten your teeth or maybe wanting to change how your smile looks? Why is it so important to see an expert rather than just an ad that you've been targeted by being like, hey, look at this. Here's a mouth guard for you.
It's super important. So I kind of think about, teeth straightening, correcting bites. You only do it once, okay? So you want to do it properly. And actually, the bite is something as a specialist we really look at. We're just not about cosmetics and straight teeth at the front. It's about really getting that bite working and functioning so it's nice and even, so you can bite and chew and things like that. So if you don't go to a specialist, sometimes the focus is just straightening the teeth, not worrying about your bite. Or even worse, there's, been these direct-to-consumer aligner companies. You don't even have anyone overseeing your treatment. It's coming from overseas. You're moving your teeth kind of by yourself at home. So it is really critically important. The other thing to that as well is we check, that you don't have any disease in your mouth, that you're okay to go ahead with orthodontic treatment. Because, teeth are a bit like, foundations for your house. And if they're not nice and healthy, there's no way we can move them. So we need to make sure everything's all right before we go ahead with that.
What have you made of or noticed about the industry when it comes to more of that cosmetic treatment, for want of a better word? What have you noticed about how that's changed over even the last, 5 years?
Yeah, there's lots of people moving into this space. I think particularly clear aligners and, everybody's claiming to be able to do clear aligners and do it well. And it is quite complicated to do that well and get you, again, that perfect bite that really fits together in a good way. So it is a little bit more than meets the eye. And I think about a clear aligner being a tool, okay? And we're driving that tool. And it's kind of like the analogy I think of if, I'm really hopeless playing golf. Like I could not play golf and hit that ball around a golf course, for the life of me.
Mm-hmm.
If Tiger Woods picked up that golf club, the same one that I had, he would smash it out, right? So it's all in the skill of the operator, designing your smile, doing the diagnosis, and really kind of monitoring your progress along that journey.
Say that someone who's listening to this is either booked in to see someone about straightening their teeth or is going to be in an appointment. What are certain signs they can look out for to make sure that they are at a reputable place?
Yes.
Either beforehand or even maybe when they're in the appointment. They can be like, oh, hang on. Dr. Sarah, I need to do that, and that's not happening.
So I guess my advice, get an opinion from a specialist orthodontist, okay, because this is what we do day in, day out. The other thing is ask the experience of the orthodontist, okay? Ask how many cases they've done. So again, you can do a weekend course and be able to do aligners, but you might not necessarily have the skills to be able to do it well. And that's kind of the problem here. You might not know that. So yeah, just ask, how many cases have you done?
Had a flashback to my own orthodontist back in Brisbane, and it was like he had this wall of like all of the smiles, like these perfect smiles that he'd helped create. And I was like, there you go, there's that case study.
I think we have that wall too.
Yeah, they're the best. I love that. Because I was like, ooh, that's what I could look like instead of my gappy overbite self, which is still intact.
It looks
My bite's still intact. You say you do it once and then that's,
do it once and do it properly.
Yeah. What do you think are some of the most common misconceptions about orthodontic treatment?
Yeah, again, I think, it's only cosmetics. It's just the way my teeth look. And for sure, that's a really big part of it. And I know with my patients, often that's the driver to come in and see me. They've hated their smile, especially women. I know this is a podcast for women and often mums, and they're kind of last in the pecking order of the family. And I've hated my smile. I've covered my teeth for photos. I never smile. And now it's for me. I look at their mouth and I go, yes, we can give you great straight teeth, but there's some problems in the back that we're going to need to fix. You're wearing your teeth, you're cracking your teeth, you're not able to have good hygiene because you can't clean them properly. So I guess we dive under the hood a little bit more to work out, kind of the other issues that can be there underlying.
Let's keep this female focus then, because when it comes to some of those underlying issues, how do hormones affect our teeth? How do they affect the mouth, our first port of call when it comes to our whole internal system?
Yeah, again, this is interesting. So probably the main effect is in pregnancy, and you get a bit more estrogen, progesterone, and what that does is actually increases blood flow to your gums, actually your whole body. And what you tend to find is you can sometimes get an overreaction to plaque on your teeth. So plaque's the stuff that you use your toothbrush to brush off where all the bacteria is. So if you have plaque on your teeth, with normal people, maybe the gums won't kind of be affected so much. But when you are pregnant, you can have an overreaction. So they call it pregnancy gingivitis, which is inflammation of the gums, okay? It's not because you're pregnant. Really, what you really need to do is maintain really good hygiene, even better than, if you're not pregnant, to keep everything nice and healthy. The other thing I hear, which is a bit of a misconception, I guess, is, I had my babies and they ruined my teeth. My babies ruined my teeth. I'm like,
I've heard that before as well, though. Okay.
Yeah. And again, not true.
Not true. Okay. Right.
Your children don't ruin your teeth. And I think that's probably related a bit to perhaps neglecting your hygiene. Yeah. So you're maybe, I don't know, I've had 3 babies. I've had severe morning sickness, and it's really hard to brush your teeth when you feel really, really nauseous. So, that can be a problem even to get into your back teeth and brush. Maybe you don't really have time to get to your dentist for checkups and things like that. Maybe also you're having like a high sugar diet. So you can only eat certain foods. And so you're having, things that are kind of attacking your teeth more and damaging them. So again, it kind of goes back to not because you're pregnant, you have these issues. It's really, you need to be ultra aware of your hygiene. Yeah, and pay special attention to it.
What are some dietary habits that we should employ or potentially look out for, and maybe also things that we should avoid?
Okay. So the main one obviously is sugar, and everybody knows that sugar damages teeth, and that's it. The one that people perhaps are not quite as aware of is any kind of drink with sugar in it, okay? Anything. Fruit juice, highly sugary, highly acidic. So when you have a drink of juice, actually that attacks into your teeth. The sugar turns to acid and it attacks your teeth. When you have that drink into your mouth, it takes about an hour for the minerals to kind of organize themselves in your mouth. So the pH actually drops, your mouth becomes more acidic. So if you have a fruit juice and you're sipping it all day, okay, or an energy drink, I know, Fernwood is, people are drinking energy drinks, your teeth are at attack all day if you're sipping that drink. So people aren't really aware of that one, and it is quite important. So if you're going to have a sugary drink, have it with your main meal, okay? And try and limit that snacking of sugary foods or, carbohydrates, that kind of thing between your meals. Try and have it with your main meal. The other tip, actually, and it's quite a good one, is sugarless gum, okay? So no sugar whatsoever, but gum, actually, if you chew that, it stimulates your saliva and it actually neutralizes the pH. So it brings things back to normal a little bit quicker.
Okay, this is good for me to know because as someone who I'm constantly chewing on my sugar-free gum, but then I worry because I chew on it so much, I worry then that I'm doing harm to my gums.
Yep. No.
Okay, this is great.
So it's fine.
As
long as there's no sugar, it's all good. But it's quite effective.
I'm a bit more worried about your answer for this one. How can caffeine affect our teeth?
Yeah, caffeine's fine.
I didn't need to be worried at all.
I guess it's only if you load it with sugar.
Okay, yes.
That's the problem. But yeah, caffeine is fine. Healthy kind of foods for your teeth, things like cheese, yogurt, milk, those kind of things are actually okay. They don't, change the pH too much. So if you're going to snack, have kind of more healthy snacks anyway. But yeah, try and avoid the frequency of sugar.
Do we need, or is this a thing where you brush your teeth after every single meal? Do we need to be doing that?
To. No, you don't have to.
No.
So you need to brush your teeth twice a day. So after you've had your breakfast in the morning and again at night, flossing.
Okay, there we go. That leads in really nicely to my next question. Okay, now, full disclosure. I, every single year, make the New Year's resolution. I'm going to floss every day. I'm going to floss every day. I haven't made it through a year yet with flossing every single day. How often should we floss and why?
Yeah, ideally every day.
Damn it. Okay.
But I do know it's hard. Okay, so being like the realist, being the busy mum I am, maybe if you can kind of sneak in at least twice a week, it's better than no flossing. Yeah. And why do we have to floss? So when you brush your teeth, you brush over all the surfaces of your teeth, you brush up into your gums, but you don't get between your teeth. Okay, there's a little area between the teeth. That's actually where cavities and things often start to form and gum disease start to form. So the only way you can sort of clean off any sort of plaque or bacteria is to get in with a floss. The other alternative, if you're a little bit lazy like I am too, you can use a little interproximal brushes. I like a little Christmas tree that go between the contacts of your teeth.
Yes.
So they're also very effective.
Okay.
The other thing that's quite good too, the water floss, which sort of blasts water between your teeth as well.
I've seen those, but I've never, again, see, this is what I mean by this is my topic of interest for me.
Yeah.
I've seen those ones and I wasn't sure if that worked.
Yeah, they do. They do work.
Is there such a thing as overbrushing?
Yes.
Because I feel like I also sit in that category as well because growing up, I was part of a generation which was literally like and maybe it was because I had braces and you had a little timer and it was like you're going to brush for 3 minutes. And then I feel now that I'm trying to correct that a little bit in that I worry that I've brushed my gums away.
Yes.
I'm like, where are they?
You actually can do that.
Oh, no.
Yeah. So again, it's brushing with a good technique, which is circles around the gums.
That's my first failure. I'm scrubbing.
Yeah,
okay.
So no scrubbing.
Yep.
And the other thing is make sure you don't have a hard toothbrush. Okay, you want a soft toothbrush, and then you can't sort of over scrub those gums. And the third thing is electric toothbrush. Okay, it's really good because you can't overbrush because it does the kind of brushing for you. You need to have the right technique, obviously, but electric toothbrush is great for overbrushes.
Are there any, I know we've mentioned a few, but are there any more unique kind of things that can affect women more so when it comes to our oral hygiene that we need to be aware of?
The other one's menopause, and that's when your estrogen tends to go down a little bit. So your mouth might be a bit drier. When your mouth is a bit drier, you're not, the saliva's not clearing as much of the bacteria out of your mouth. You can more susceptible to decay, gum disease, that kind of thing. Also, as you get older in general, you get a bit more susceptible to gum disease. When you're a kid, you might have inflammation, but it's not periodontal disease, which is actually full-blown gum disease, where you're actually destroying the bone that sits under the gums, okay? Loosening that house, if you think of the foundations from the house. So when you're a kid, you can kind of get away with it, but it's really important to kind of get in and get that good technique early on. The older you get, the more likely you can have periodontal issues. So if you're not brushing properly, there's a genetic link as well. So if someone in your family has gum disease, to be aware of that also. Healthy diet. If you're not eating the right foods, not getting the right minerals, calcium, vitamin C, that kind of thing, it can affect that and make you a bit more predisposed to gum disease.
If we're having any kind of sugary drink,
Yes.
be firstly mindful of it.
Yes.
And then limit it to with your main meal rather than sipping
and
throughout
really,
the day.
Water.
Water.
Good old water. I know it's very boring, but water is, and no lemon. Lemon's acidic, so just plain old water and just drink that. If you're going to have, your fruit juice or a smoothie or a Slurpee or something like that, have it with your main meal.
What's the way that we can make sure that we are getting to our back molars when it comes to brushing?
Yeah. Just technique.
Technique.
Open
okay.
wide.
I've got so much work to do.
Get in the back there. Yeah. So I guess, sometimes you learn to brush your teeth when you're quite young. And there's great YouTube videos and things like that even now. If you're unsure, just go and have a look on YouTube and, it can be really helpful just to revise even as an adult, how to do things, how to floss. Like a lot of people don't know how to floss properly. They just like jam it between the teeth. But actually you want to go either sides around each of the teeth, right to kind of the neck of the tooth. There's a bit of a technique to that as well. So, yeah.
See, I avoid that as well because I'll remember to floss just like 2 weeks before my dentist appointment.
And they can tell.
They can tell.
Yeah.
So, okay, here we go. All right. Can your dentist or orthodontist, depending on what treatment you're getting, can they tell if you have been trying to repair neglect in like 2 weeks and you're trying to pass off that, I take real good care of my teeth? Can they tell?
Usually, yes.
Okay.
However, if you have gingivitis, which is inflammation of your gums, you've just been a bit lazy or haven't quite got to the back tooth, that kind of thing, you can reverse it. It's reversible. So if you go and have like great technique, maybe 3 or 4 days, that inflammation will be gone. So yeah, you can go in there squeaky clean into your dentist and go, wonderful, wonderful news. So yeah, you can. Gingivitis is reversible. Periodontitis, which is where the bone starts to be eaten away, is kind of, you can stop it but can't reverse it. Okay. You can't bring back the bone, but can stop that disease process. Who do you go and see? You go and see your general dentist, and then they actually may refer you to a specialist dentist called a periodontist, who's a specialist at treating gum disease. Okay. Yeah.
I'm learning so much, and if I'm learning so much, I know that you at home are also learning so very much. Don't go anywhere, but make sure that you share this episode with everyone that you love because we all have teeth. We'll be right back. Why do wisdom teeth get such a bad rap? Why are they the first to go? It's like something's wrong with your mouth. It seems like, we'll take the wisdom teeth out.
So wisdom teeth are, we call them third molars. So they're molars that sit at the very back of our mouth. And kind of as we've evolved, our jaws have become a bit smaller. So most often we don't have room for the wisdom teeth. So these poor teeth are at the back of their mouth. They tend to try and push through kind of in your late teens, early 20s usually. And, 3 things might happen. 1, they actually push through and they function. Great. Okay, you can use your wisdom teeth as an extra tooth in the back. The second thing is that they stay under the bone, under the gum. We monitor them, okay? We just keep an eye on them. That, again, why you need to have general dental checkups, x-rays to check what those wisdom teeth are doing and check that there's nothing untoward happening with them. The third issue is that they can come partially through. And I'm not sure if, you've had friends or anything with wisdom teeth. It can be very painful. You get quite severe infections in the back. It can travel to your whole face. It can go down your neck. It's actually very, very dangerous. So if you're starting to get teeth coming through, they don't have enough room, then that's usually when they need to be removed. The other thing is they get blamed a lot for causing crowding.
Yes.
Okay.
I think I had mine removed because it was a crowding reason, I'm pretty sure.
So again, a little bit of a misconception there. So even though they're in the back, they're sitting in there, the studies show that even if you don't have wisdom teeth, you get lower crowding as you age. Often, people who've had orthodontic treatment, they wear a retainer at night. So once we finish moving your teeth, you need to wear it might be a wire behind your teeth or a nighttime retainer. And they might stop wearing that retainer. So, get to their 20s.
You're talking into my soul right now because this is me.
Now we don't think it's so important. And now your teeth have moved because actually retention is forever.
Yeah.
And your teeth move. And sometimes wisdom teeth get blamed for that. But actually it's not wearing the retainer, or it just might be that natural crowding as well. So, like I said, the studies have shown that people who don't even have wisdom teeth get this crowding with time. So it's not a real clear association between them causing crowding or not.
I want to talk about the retainer because it's close to my heart.
Yes.
As someone who had, I'm going to say finished in quotation marks, most of their more intense orthodontic treatment by the age of 12,
yes.
I was like, oh, yeah, then you've got to wear your retainer every day. I've not done that for the last 10 years, and now I can just start to see my teeth moving. And every time I look at it, I go, oh, no, it's happening. Can I fix that? How do I fix that?
Yes. So I tell my patients retainers are for life.
For life. Yep. Okay.
My patients wear their retainers at nighttime, like a little clear mouth gun. I call them pajamas for your teeth. Put your jammies on, put your teeth jammies, and you're all good to go. So initially when you have finished orthodontic treatment, you wear them, in my practice, every night. Okay, that holds your teeth because the gums are like, they have these fibrous, they're like rubber bands, and they want to pull the teeth back to their original positions. So we need to hold them in that position until they reorganize. And that's what the retainers do. And then going long term, you might not need to wear it every night. You might need to wear it 1 or 2 nights a week. In my family, we have Sunday nights retainer night. We all put our retainers in and we're good to go for the week. So, but it is one of those things that's really important, or else they shift. And as you've noticed, the teeth have shifted, probably the lower teeth shifting a little bit.
They are my lower teeth. Yep.
And that's that natural progression. A lot of my patients who have clear aligners have had orthodontics when they're a child, and perhaps the retainer got lost, broken, or wasn't emphasized back in the day. They might have been told wear it for a year and then don't worry about it. So we can realign your teeth. The kind of good news about that, if you've had really good orthodontic treatment, usually your bite and everything holds pretty well, and it might be like a minor kind of touch up, all right, just to realign the front teeth, that kind of thing. So, you're probably not going to go into a big comprehensive treatment. It would be unlucky if you had to do that.
Okay. Yeah. This is good. Is there a main difference why a patient would receive like a wire behind their teeth rather than the retainer? Because I don't have a wire.
Yeah, sometimes it's personal preference from your orthodontic specialist. Some people routinely use wires, some people don't. In my practice, I use wires if there's a real chance of those teeth moving back. So if they started very crowded and crooked, then they're more likely those gum fibers are going to pull them back. If you start with gaps between your teeth, again, gum fiber is going to pull the teeth apart. So for me, it's a little bit selective who I use it for. The wires are great in that they hold your teeth day and night. You still need to wear a retainer over the top to hold your side teeth because they only sit on the back of your front teeth. So you still need to wear a retainer. They're harder to clean. So you need to use special floss threaders and things like that. Regular checkups with your dentist. They can break as well. And at the moment, I'm treating 2 patients where the wires actually moved a tooth in a really unfortunate position where the patients are about to lose the front tooth. So you have to be really careful with the wires that they're placed correctly and placed by someone who knows what they're doing.
That expert. See, you got to get back to the experts. Now, this is going to come potentially as a surprise, but again, as I've said already on this podcast, this is a particular area of interest for me. I spent a vast majority of my life watching embarrassing bodies.
I love that program too.
Isn't that great?
I do.
Right? I should come over to your house when a retainer night and we put on embarrassing bodies.
We will.
But I digress to that because one of the biggest causes of embarrassment for so many of those patients were teeth related, and it was mouth related, and it was they had let themselves and their mouth and their hygiene deteriorate to such an extent that now they're in severe trouble and they're going on a show like Embarrassing Bodies to try and get help. How does our oral health affect our self-confidence?
Oh, that's a huge, a huge question. Yeah, it really does. So I think, I'm in the business of smiles and good bites. So for me, gosh, to have a good smile is a very important factor. Okay, both for your self-esteem, socially as well. If you have a good smile, you have good teeth, you feel better about yourself. You might get that job, because you really are presenting yourself, in a different manner. So, and studies have shown that, like a good smile, healthy teeth really improve self-esteem and let you get along better in life. Yeah. The other thing is, if you're not looking after your teeth, and I know from the Embarrassing Bodies, it's pretty bad. And some of those people really have had some tricky times in their life, right?
They have.
And they really haven't looked after themselves. And now, the whole thing is like taking care of yourself, taking care of your body, taking care of your teeth, and just sort of, getting yourself back on track. So, yeah.
Well, I think it touches on something, a sentiment that you talked about at the start of the episode, at the start of our conversation, which is that it's not just how you look that's giving you the confidence, right? Because if something's not feeling right, you're not going to feel great either. And we want to take that embarrassment out of it because we just want you to be living to your full potential, for want of a better phrase.
Yes.
And half of that starts with how you smile at people. It's honestly your first interaction.
It's true.
With almost anyone.
And I think also I have quite a large adult practice. I work in the city and I have a lot of females again, and honestly, it changes their life, and I get told that every day. I mean, it's amazing to be in a job that every day I'm like, wow, you've changed my life. I smile. Like, it's brilliant, right? Something as simple as correcting your smile has that much of an impact, and it is the first thing you see in someone's, you look at their teeth, you look at their smile. I know when we're in COVID lockdown, which was a terrible, tricky time for everybody, patients were coming in. They're like, I cannot look at myself on Zoom. I'm just looking at my teeth and I'm like, I need to do something about my teeth. And yeah, that was a catalyst for them to kind of make that change. Yeah. And what I would say as well, like, a good proportion of my patients are, 30, 40, 50, 60-year-olds actually. So it's never too late to straighten your teeth and give yourself that confidence in your smile.
Okay, so I find this fascinating. So at any point in your life, really, you can begin again on your teeth journey, or just you can relearn, you can get better?
You can. So there's different stages, I guess, with orthodontics in particular. So we treat a lot of kids, all right, and timing can be quite important for growth and things like that. So definitely we need to see kids earlier to kind of harness things so we can get the best possible outcome. When you're an adult, though, you might have had orthodontic treatment, the teeth have moved, or you've never had the opportunity to do it, and you have a terrible bite. I had a patient yesterday, she was a doctor, she only bit on her back teeth. She's like, I can't bite anything. I can't even chew pasta. It just kind of slides down the back of my throat, and she had such a severe bite that it was impacting her eating and general health. So, for her, that was a major functional issue. She said, I don't really worry about the look of the teeth. For me, it's a functional issue. But I guess what we look at is sort of the combination of both that function and aesthetics as well.
Mm. What are some of the other stories, if you don't mind sharing them, that you've got to experience with your patients that you've gone,
yeah,
that's great.
I've got a few. I've got one patient, and I treated her many years ago. Her name was Barbara. She was English, beautiful lady, very prim and proper. And she had gone for about 3 different opinions, told she needed jaw surgery. She was 60. She didn't want jaw surgery. I'm like, wow, let's see if we can do it with clear aligners, because we can do some different kind of treatment options with clear aligners. Treated her out, gave her a beautiful bite. She looked about 10 years younger. She could bite and chew. Again, she had an issue like the other patient where she was only biting on her back teeth. And at the end of it, she said to me, Sarah, you've changed my life. And again, she was very prim and proper. She goes, can I give you a hug? She gave me the biggest bear hug. And actually, probably out of all the patients, and there's, thousands I've treated, she's very impactful. Another patient who was 87. 87, who came in and she wanted her teeth straight for her granddaughter's wedding. Yeah, and she'd hated her teeth all her life. And she was the happiest patient. Unbelievable. Like, so happy with her smile. Showed me the photos from the wedding. They looked amazing, 3 generations of women with great smiles. So, yeah.
Because I know that people will be listening to this and they'll go, okay, it's never too late for me. I can look at this now. I've got maybe that event coming up. How timeframes? Let's talk timeframes. When if you do have something like your granddaughter's wedding coming up, and you are 87 years old and you need to think about this, when do you need to book in so that you'll be okay for that event?
You need time.
You need time. That's why you need to start thinking about it now.
So tooth straightening is definitely a slow but sure process. We can't move the teeth too quickly or else we can damage the roots of the teeth, the bones, that kind of thing. So depending on the complexity, so again, some things can be like 6 months and you're done. Some kind of issues with teeth can be 2 years. So if you're thinking about straightening your teeth, get in early. I guess the caveat to that is things like clear aligners, where you can remove them for the day. So you can be straightening your teeth. So I have lots of brides, and we're kind of halfway through, and they can just take them out for the day or that kind of thing. So we can manage it. But yeah, definitely the more notice, the better.
I feel this is going to be a question without notice, but it's just come to my attention that there could be people yelling at the radio, their phone, their headphones, however they're listening to us right now, that is saying, what is in practice, how do clear aligners work? Like, how often do you have to take them out? Are they in every single second of the day?
Sure, yeah. So clear aligners are like a little thin mouth guard that move the teeth into the correct positions. And what you do, you have to wear them pretty consistently. So it's about 22 hours a day. Take them out when you eat. You take them out when you brush, floss, that kind of thing. And you do change them, kind of depends. Everyone's a little bit different on their protocol, but in my practice, it's every week. You change into a new one. What happens is they are an orthodontic appliance and they're gradually shifting the teeth into the correct position. So it's quite a gradual process. So pretty comfortable, actually. I've worn them on my teeth. You do need little bumps on your teeth called attachments. If you've seen people who are wearing them, you might see these looks like little bubbles or bumps on the teeth. And they're quite helpful to grip the teeth to allow us to move the teeth into the correct positions. What I like about them, it's a great option, particularly for adults, who are working. And I have patients who are judges and,
a lot of my colleagues, TV presenters.
TV presenters.
They've had them. Yep.
We've had a few of those through the practice too. Yeah. So you can't really tell that they're moving their teeth, right? So you can kind of do models, things like that. But even anyone, an adult who doesn't really want to wear braces, right? Like not every adult wants to have, braces on their teeth. So you can use them for kids as well. Compliance is really important.
Yeah, you've got to stick to it.
You've got to stick to it. So if you are going to do that, you have to be really committed. Because if you're not wearing them, they're not working. So that can be a bit of an issue.
As an orthodontist, you're very passionate about people's bites.
Yes.
How does grinding affect our bites, and how can we stop it?
Yes.
And can we rebuild teeth? I don't know.
Yeah, grinding's an interesting one. So it's actually pretty common. So probably about 1 in 5 people clench or grind, particularly at nighttime. Quite a lot when you think about it. So grinding can be kind of a number of things. It can be you're stressed. Yeah, you've got an exam coming up or you've got an important work event, that kind of thing, a meeting. you're clenching, grinding. Can be a poor bite. So your bite is not, you've got a sort of interference and you're just trying to grind into the correct position. So kind of a number of factors. It can be just your muscles. You've got really strong overactive muscles and everything. And if you think about your face, you have these huge muscles connecting everywhere that are overworking and overacting. So what can you do about it? It's hard to treat, to be honest. So we can correct bites for sure, and that's orthodontics. It may be that you need to wear like a little splint or a bite splint, something your dentist can make to wear over your teeth at night to prevent you from wearing into your teeth. So you're wearing into the bite splint rather than actually your teeth.
Mm-hmm.
Holidays are helpful. If you're stressed, go on a yoga retreat.
Is good. It's medical treatment.
Go and do a workout and de-stress. So that kind of thing. But yeah, a bite, it can be very destructive to your teeth. Yeah. And again, making sure you have your dental checkup, making sure the dentist is picking up on that kind of thing as well. You're not cracking teeth and things like that. And it can be, grinding can be okay for a while, and then the teeth, can break and crack, and you can have a lot of issues. So, yeah.
We've covered so many different topics in this chat. What would you say, overarching piece of advice for anyone who's like, wow, I really need to lift my game when it comes to my oral hygiene?
So I guess as basic advice is brushing and flossing, using a fluoride toothpaste. And it sounds really boring, but that is the ultimate key. Okay. So keeping that really good hygiene is number one. Second thing is making sure you do regular dental checkups, with your general dental practitioner. They check your teeth. They do x-rays to check you don't have holes in your teeth. They give a really good clean and get off the tartar that you can't actually do yourself. If you're thinking about straightening your teeth, make sure you go to a specialist, we're the people who are the experts at doing that. And yeah, make sure you're in really good hands in that respect.
Anyone listening who wants to find you in particular, how can we do that?
Yeah, so you can probably jump onto our website is laverinlnlorthodontics.com.au. So, and my name's Sarah Lawrence. I'm happy to help anyone.
She's in the business of smiles, people. In the business of smiles. And finally, what do you hope someone's taken away from our chat today? I've got so many notes that I've taken away.
I guess, the importance of oral health and looking after, and really the importance of that being part of your whole health. And I know this is a podcast for women who are interested in health, right, and exercise and things like that. And for me, taking care of your health is just as important as going to the gym and lifting weights and, doing your cardio, that kind of thing. So make sure your teeth are really in good shape. You're looking after your hygiene. Straightening teeth, you can do any age, There's no age limit or anything like that. Advantages of straight teeth are a good bite. It's easier to clean, It's easier to clean and floss when the teeth aren't all crossed over. And therefore will stand you in a much better position for the rest of your life.
Dr. Sarah Lawrence, thank you for joining us on Fernwood Unfiltered.
Pleasure. It's been fun.
We've gone so many areas and it was the best. Remember, if you've enjoyed listening to our wild chat, make sure that you share it with those that you love because, again, I'll reiterate, everyone has teeth. Until the next episode. Thanks for listening to another episode of Fernwood Unfiltered. Just a quick note that the information shared in our episodes is for general educational and informational purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. So always seek the guidance of a qualified health professional regarding any medical condition or concerns you may have. Catch you in the next episode.